Today's episode about eyeballs is brought to you by the Nuance Dragon Ambient Experience, or DAX for short. This is AI-powered technology that helps physicians be more efficient and reduce clinical documentation burden that causes people to feel a bit overwhelmed and burnt out. To learn more about how DAX Copilot can help reduce burnout and restore the joy of practicing medicine, stick around after the episode or visit nuance.com/discover-DAX. That's nuance.com/discover-DAX.
Knock, knock, hi.
Knock, knock. Hi.
Hello, everybody. Welcome to Knock Knock I with me, your host, Dr. Glockenflecken. I'm excited to talk with you all today. This is your one-stop shop for all things eyeballs. Why are you shopping for eyes? I don't know, but you're here. You're doing it. I mean, you're here to be educated about the eyes, and I'm here to do the educating. I'm sitting here in my recording studio, my recording cave, if you will, my eye cave, my orbit. This is my bony orbit. That's what I'm going to call it. At least when I'm doing this and not when I'm, doing the normal episodes with Kristen. But anyway, I get to talk all about the eyeballs today. We're going to be talking a bit about tears, about tear film, about treatment for dry eye, about dry eye itself, about why your eyes get dry and what you can do about it. It's a big topic, one a lot of people have asked for, and so we're going to get to that a little bit later. But it's graduation season, you guys. And that's a busy time for me. I usually do one or two commencement addresses every year, and I'm going to the University of Michigan this year. I'm very excited about that, and I've been working on my speech. It is hard I feel like I got to come up with something different every year, because every year my speech video of my commencement address gets out there on social media. Sometimes I put it out there, but it ends up getting out there. So I do feel like I need to say something different every time, and one person can only be so inspirational in different ways. I'm not saying I'm inspirational, but more like I got to come up with new jokes. That's sometimes a hard thing to do. But it's also this time of year, I started thinking a lot about my own education and med school and my path to ophthalmology, and I get a lot of questions from med students about ophthalmology, specifically about like how to get into ophthalmology. I pretty regularly I'll get questions. People email me, new med students, sometimes pre-meds. They're like, "What can I do? Do you have any advice? What can I do to get into ophthalmology?" And that question has become harder and harder for me to answer. Every year I get further removed from my med school, from my residency years, it gets harder to answer that. And I think there's a lot of reasons for that. One, I'm getting old, you guys. It's like medical education has changed so much, and I'm not in an academic environment to have that insight to be able to tell students, like, this is what you should be doing to guarantee yourself you're going to get into ophthalmology. I mean, there's no guarantees in life, but so what I thought maybe I could do here, so that now people can just like refer to this, is I do try to answer those emails when I can. I do get a lot of emails, so I do my best to try to answer people. Sometimes I can't get to everybody's emails, but what I thought I could do is I'll just tell you like what my resume was, like what I did, and that how I guess it ended up allowing me to get into ophthalmology. I would say I wasn't like the most slam dunk candidate out there when I was interviewing, when I submitted my application. I was interviewing as a fourth year med student or third. I don't even remember the timeline. It's like, during the fourth year. And so, but I wasn't like a weak applicant either. I was a fairly strong applicant, but I was sweating a little bit, just a little bit. I was sweating a little bit. So I came into med school. I didn't know what I wanted to do for my career. I knew I wanted to be a physician. I had no idea what type of doctor I wanted to be. I thought about all these different things. I thought about cardiology at one point. For the love of God, cardiology. I thought about cardiology. Sometimes I think, what would that have done to my comedy if that had been where I ended up? Radiology was a thing for a while. Like I had a brief little flirtation with OBGYN because I just had an awesome OBGYN rotation. I loved all the physicians I worked with, all the surgeons. It was it was a really fun rotation. So it kind of gave me a bug that lasted just very briefly. So anyway, I was all over the map. I was all over the map. And so I decided so late, actually, that I wanted to do ophthalmology that I had to take an extra year of med school. So I actually did my med school in 5 years. I was at Dartmouth, and they did this thing. They don't do it anymore because too many students were doing it, where you can split your 4th year into 2 years, and you only have to pay like a small amount of additional tuition. So it was a great deal. It was a great deal because you got a big discount on tuition, but you get an extra year to kind of like do just an extra 4th year. And everybody who goes through med school knows the 4th year, that's a nice year. So I enjoyed it. I enjoyed my time, but really I had to do it because I decided it was like maybe 2 months before I was, applications started like opened up. And I was like, oh shit, I want to do ophthalmology, but it's so late. I don't have any of this stuff I need to do. So anyway, I took the extra year, and in that extra year, that was when I did like all of my resume building for ophthalmology. So I did 2 different away rotations. I went to University of Illinois in Chicago because we were targeting the Midwest, and I did another one that escapes me. Oh no, it was like a research elective. That's what it was, with somebody actually locally, like in the Northeast. So it was I did one away clinical rotation, and then I did some research, you guys. So here was my research experience. I did bat phylogenetic research in undergrad. I got 1 publication, a second author publication out of it. That's what I had in undergrad. And I went into med school. And in med school, I got a grand total of 0 publications. I had some research experiences, though, that I got to talk about. They weren't very exciting. It was not very exciting stuff, but it was in the field of ophthalmology. So I got to talk about it. I got to show that I was interested. It really is hard to get publications, I think. If you're doing it like the legit way, later on in the ensuing years, I have talked to different ophthalmologists who they told me, like, as med students, all the med students who were interested in ophthalmology, they would all get together and they just put each other's names on their publications. And I was just dumbfounded by this. It's like, that's a thing? You can do that? You just like don't have to really do any work. You can just put a name on. I don't know. It to me, it kind of cheapened the whole idea of doing research. And so I don't personally put a lot of stock in research in terms of making yourself a competitive candidate for residency. But you do have to play the game, right? And as far as I know, and again, I'm not in academics anymore, please, just looking at an Excel spreadsheet makes me want to throw up a little. I am not a research person. All right. I think the last thing I tried to publish, I ended up having to put it into the Journal of Siberian Ophthalmology because nobody was accepting it. And then I swore off research and went into private practice. But it's an important thing. And so I think it's still important to convince the powers that be that you are dedicated to this field, which I think is honestly silly. And so I had my little research experiences, and I did well on my STEP exams. I got a 2, back when STEP exams were scored, I got a 247 on my STEP 1, which was a really good score. Not like otherworldly, out of control, like 260 thing. I was happy with that because it allowed me to keep my foot in the door of ophthalmology. and then I didn't apply with step 2. So I just had step 1 as my like big exam thing. And got honors on all my rotations. I worked my ass off on my rotations. My letters I got from my advisor in ophthalmology at Dartmouth, from my sub internship. People call it acting internship in some places now. I don't know. But it's basically like I worked with an internal medicine attending on their internal medicine service for like a month. That was like one of the hardest months I have ever done. I have worked really hard, made a bunch of mistakes, but did a lot of good things too. and eventually I got a letter from that doctor, which is a really good letter. And then I also got a letter from my away rotation at UIC from my advisor there. So those are my letters, and they were really good letters. And so all of that together, I went on 10 interviews. I got like probably 14 offers for an invitations to interview. I went on 10, I think, which, because statistically that got you like 90 something % chance of matching if you got to 10 interviews. That's why I stopped at 10. And it's freaking expensive. I was like taking out loans to go on. It's outrageous. I'm still paying off those interviews. And it worked out. I got my second choice. I wanted to go to University of Michigan. They didn't want me. So I ended up at Iowa, which is also a top 10 wonderful ophthalmology program. Very happy I ended up there. But I think it also is kind of fun that now I'm going back to the University of Michigan. Not back. I was never there. I interviewed. I didn't go there. But now I get to go to Michigan and as the commencement speaker for their medical school. And so I'm gonna have some fun with that whenever I give that commencement address. By the time you hear this, I will have I think I've already given it. And so back to the whole reason I told you my entire resume for ophthalmology, I don't know how much of that translates to now in medicine, because now we don't have a scored step exam. At first when I heard, it's going to pass fail, like a lot of people, I was thinking, oh, great. I was a nervous wreck. I was going absolutely insane, doing, USMLE world questions for like a month straight. I was losing my mind. It was a terrible time doing that dedicated study time. And I was like, oh, that's going to make things better. And one thing I failed to consider is that med students we're all kind of neurotic. And none of us are normal, and we're all going to put so much pressure on ourselves to a fault that it doesn't matter if something's pass fail. Like, we're going to hold ourselves to this impossible standard, and we're going to be stressed out anyway. And as it turns out, now all that stress is like moving down the road to like step 2, it seems like. So in the end, I don't think it really helped as far as mental health going from a scored step 1 or step exams to and I promise we're going to get to an eyeball topic here shortly. I'm sorry. But I don't think it did what they thought it would do. Maybe the data will tell a different story, but it just doesn't seem that way in the emails I've gotten, the conversations I've had with people, the things I've seen on social media. And so step that before I would say, you make sure you do really well in step 1. Well, that's, out the door, maybe step 2 now. And then, research, we already talked about that. I'm very jaded when it comes to research. So, I tell people, you should probably do research. I'm not the person you should be asking about research, because I didn't do a lot of it. And the stuff I did was bad. And so, and so anyway, the point is I feel less and less helpful with each passing year for students, trying to figure out what they should do to get into this field. The last thing I want to do is give bad information. I will say this, knowing what I know about being a resident in an academic center, one thing I found extremely helpful with the med students coming through was if any of them knew how to do basic eye exam techniques. I think that is exponentially more important and more helpful than some rinky-dink research opportunity that's not going to go anywhere, that you're going to half-ass it. If you can learn to get a reliable vision testing, if you can learn how to refract, my goodness, if you know how to refract a patient, you will be a resident's best friend. If you're at a med school that has a residency program at the university and you can refract, oh man, they're going to put you to work and you will get glowing recommendations, and you can talk about this in your video. Look at all these things I can do already. If you can get a decent look at the back of the eye, learn how to use an ophthalmoscope. I mean, these are the things that are so difficult to do and really can limit you right away. Then you don't have to know how to do these to at the beginning of residency, but that's the kind of thing I find more helpful than anything else. And I wasn't able to do anything. So I'm not even talking about myself. I'm just thinking about other students I have seen come through, especially when I was a resident. So anyway, take that how it is. How you take that with a grain of salt if you want. Whatever stock you put into that, maybe it's helpful. That's just my 2 cents. All right, let's take a break. We'll come back with some eyeball stuff. All right, my friends. It is the moment you have all been waiting for. We are talking about dry eye today. Now, you might be asking yourself, why would you do this to us? Well, that's a good question, because I personally do get kind of sick of talking about dry eye, because I talk about it a lot. But that's the reason I want to talk about it, because it is probably the most common thing I see in the eye clinic day to day is dry eye symptoms. Everyone's got dry eye. There's a lot of reasons for that. We're going to get into it, but it's a massive, massive problem. It's also a massive topic. So we're not going to get into all the details, although I was just going back and looking at some of the YouTube comments on my recent Knock Knock Eye videos and on YouTube. And one comment says, because a couple times I've said, I hate to get too into the weeds on something like this. And somebody was like, that's when I really love the videos, is when you get way into the weeds and I have no idea what you're talking about, but you're so enthusiastic about it. Okay, they didn't say because you're so enthusiastic about it. I just projected that, but that was really reassuring to me. I loved hearing that, because can I find some weeds for you? I can get all up in those weeds, you guys. I can. Oh man. And some of these topics I've already done, we may have to revisit so I can get further into the weeds, like neck high weeds. And I'm a tall person. Okay, so. That just, you have emboldened me to really just get after it with these eyeball topics. All right, so here we go. Dry eye. So the first thing we got to do is talk about tears. Now, tears, it's not just tears actually can be quite complicated. We got to talk about the tear film, because dry eye, lubricating the eye is a team sport, you guys. There is so much more to it than just say, oh, your eye, you got tears. That's it. You got to blink. That's it. No, we got to talk about the tear film. So this is the lubricating organism for your eye. All right. So the tear film, which is exactly what it sounds like, it's a film that goes over your eye. That we consider that's made up of a number of different things. There's 3 layers to your tear film, which is, by the way, your tear film is always on your eye, all right? Unless you have unless you have dry eye problems, then the tear film will start to break down. And that's when you start having symptoms, which we'll get to in just a second. First, the tear film, an underrated, very important part of the eye. So the bottom layer, this is the layer that's like sitting right on the surface of your eye, all right? You have the mucus layer. So your conjunctiva has all these little goblet cells that make mucus. All right, so that first layer right on top of the eye It's just this nice thin little layer of mucus. Now, there are things, diseases that can destroy those goblet cells, thereby destabilizing the tear film. Because if you don't have all three of these layers I'm going to be talking about, all right, the tear film breaks down and you get dry eye. All right, so the bottom layer, goblet cells making mucus, that first layer. Second layer is your aqueous tears. All right, so you have lacrimal glands. You have these smaller lacrimal glands, and then you have your large lacrimal glands that cause you to produce lots of different types of tears. You have this, what we call basal tears. So your eye is constantly making tears from these small little lacrimal glands in your eyelid and the space around your eye. You're constantly making those tears. That's your basic level of tears. Then you also have something called reflex tearing, all right? If you go outside and a strong cold wind hits you right in the face, I went to Fargo not too long ago. I had that cold wind right in my grill. Reflex tearing, all right? That comes from your bigger lacrimal glands. It'll start to you just flood the eye because obviously you have something like air blowing in your eye. It's going to blow your tears, your baseline tears out of the way. So your eye's like, oh crap, I got to make more tears because look, this air, it's drying out the eye. So you make a bunch of tears. Those are reflex tears from your big lacrimal glands. And then the other kind is emotional tears. All right. So a sad movie. We just watched Coda, the movie. We had a family movie night recently. We watched Coda, which is about, it's a coming of age story about a woman who's a child of deaf adults. That's what Coda stands for. It won the Best Picture Academy Award and a couple others. Wonderful movie. And I'll be honest, my emotional tears were acting up. I was welling up a little bit at a few parts. You should see it. It's great. Sometimes it feels kind of good to cry during a movie. Don't you think so? Anyway, that's another type of tear. And so all of this makes up this aqueous layer of tears. Mostly the basal tears make up that aqueous layer in your tear film. Your third layer is the oil, the lipid layer. All right. This is what insulates your tears. So in your eyelid, your upper and lower eyelid, you have these things called meibomian glands. They're tiny glands. You have 40 of them in your upper eyelid, 30 in your lower eyelid. They're basically right where your eyelashes come out of the eyelid. That's right where your meibomian glands are. They are, whenever you blink, they're constantly pushing out this oily discharge, this oily secretion from the gland, all right? And that oil forms a layer, the third layer, the top layer that insulates everything, all right? That just keeps those tears on the eye. So those are your three layers: mucus, then aqueous, then lipid, oil layer, all right? So I mentioned if something goes wrong with any of those three layers, you end up with dry eye. So that's really it. That's the way you think about dry eye is which of those layers is screwed up. All right. So let's take the mucus layer. That's probably the one that's least likely to get screwed up because most people have healthy conjunctiva. That's the white part, or not really the white part. It's like this translucent layer on top of the white part of the eye. Constantly making this mucus. That's why it's a mucous membrane, everybody. That's what your eyes are. But if you have diseases that disrupt the conjunctiva, so chemical burns, things like Stevens-Johnson syndrome or ocular cicatricial pemphigoid or or any kind of trauma or scarring of the conjunctiva can decrease that mucus layer. That's actually probably the least common way to get dry eye is disruption of the conjunctiva. We don't see that very often. All right. Then we go to the next layer, the aqueous layer. So something that disrupts your tears. We have things like Sjogren's syndrome, which is an autoimmune disease where you get It's a disease that inflammatory disease that affects the lacrimal glands and can decrease the amount of basal tears, really all tears that we just talked about, that you make. Sjogren's syndrome, you end up with a loss of that aqueous layer. Your tear film breaks down. You get dry. All right, that's an example of loss of aqueous. There's other things that can do it too. You can have tumors of the lacrimal gland that can disrupt the ability to produce those tears. And so anyway, that's the aqueous layer. The third layer is that oil layer, that lipid layer. And that's probably the most common type of tear film, a breakdown that we see, is when you don't have a nice, even oil layer on the surface of the eye. This is what we call evaporative dry eye. Because what happens is if you don't have that oil layer that insulates the tears, then the tears that you make, the rest of that tear film, it's going to evaporate very quickly. Because remember, that oil layer, it just covers everything else and it keeps it on the eye. But you don't have that oil anymore because those oil glands, those meibomian glands, they're just not working. All right? And so the tears you make, they evaporate quickly and you end up with dry eye. So what are the symptoms? What are people coming in with? And I bet a lot of people listening to this you're going to have some of these because a lot of it has to do with screen time. So the classic symptoms that people have is if you're spending a long time reading, watching TV, on your phone, driving, basically things that really are good at holding our attention, which everything in society now is good at holding our attention. Everything, it wants to hold your attention because then they have advertising, they make money. So what people find, what people will describe is when they're doing those things, those activities, things will start to get blurry. And then they stop or they blink and they can clear things up. They blink away the blurriness. That is classic dry eye, 100 times out of 100, pretty much. And so that's why we've talked about the 20-20-20. Every 20 minutes, you should take 20 seconds and look away from what you're doing. To rest your eyes, to remind you to blink, because studies have shown when we're doing those attention grabbing activities, we don't blink as much as we're supposed to. All right. I guess maybe we could do a don't do that eyeball tip of the week. Oh, we'll come back to that. Come back to it. So have good goblet cell activity. That's your do that eyeball tip of the week. And make sure you really have those healthy goblet cells. Taking breaks is always going to be helpful because you need to blink. But meibomian gland dysfunction is something that we see. Virtually everybody, I would say over the age of 60, has some degree of those meibomian glands not producing oil. And so that's why it's such a common thing, because most of our patients are older patients. I see 90% of the patients I see are over the age of 60. And so we're constantly having this conversation. And so what do we do about this? So those are the three layers. When you destabilize one of the layers, it causes the tear film to destabilize and you get dry. You start to get blurry. Your eyes start to feel scratchy, grainy, gritty, like there's sand in your eye. You ever feel like, it feels like there's something in my eye. People are convinced they have an eyelash in their eye, but I look and there's no eyelash. But the reason they feel that is because the cornea is extremely sensitive. It has the highest concentration of nerve fibers in the human body. All right. It doesn't have the most. It has, or maybe it does have the most. I always get this confused. Maybe it has the most and the clitoris has the highest concentration. It's one of the two. Anyway, they're the two most sensitive parts of the human body. And so with the cornea, that's why it feels like there's something in your eye whenever the eye gets dry, because the cornea doesn't want to be dry. You destabilize that tear film, the cornea is not happy because it has dry spots. And then those really sensitive nerves, they start firing, they start acting up. You don't want that. So what do we do about it? So a patient comes in, they got dry eye. Well, I got to figure out what type it is. 90% of the time, it's going to be that evaporative dry eye. My Boehmian glands aren't working well. So what we'll do is we got to try to make those glands healthier. There's a variety of different ways. The baseline treatment, and this is something that everybody could do. You could do right now. I'm happy to give you a little bit of medical advice here. All right, this is what you do. You get some artificial tears from the store. Again, stick with brand names. I don't have any financial interest in any artificial tears, but Refresh, Sustain, Blink, TheraTears, those are all good. Stay away from Visine. Get the Red Out products. I mean, there've been a lot of bad PR with generics lately, so I don't know. Maybe stay away from those. And so get yourself some artificial tears. You can use those, 3, 4, 5 times a day, every couple hours if you want. And then hot compresses. People always roll their eyes at this really hot compresses. Kristen always makes fun of me because she feels like she can take call for me. She's like, oh, just put a hot compress on it. Well, yeah, that's 50% of my on-call time is talking about hot compresses. So it works. So you take a hot washcloth or something you can heat up in the microwave. It doesn't even have to be wet. It could be dry heat. You can get a rice bag or something that you put on your joints. Well, you can just drape it over your eyes. And that heat, it helps to open up those meibomian glands that you need to have a healthy tear film, everybody. Hot compresses, artificial tears. Hot compresses twice a day if you can. All right, you can do it more if you want, but it takes time. It's 3 to 5 minutes out of your day. Instead of scrolling TikTok, do a hot compress. How about that? So anyway, that's your baseline treatment. And then some people have a lot of inflammation on the eyelids, so we'll talk about eyelid scrubs. Basically, when I talk about eyelid scrubs, I tell people, in the evening, and this is a good thing to do, especially if you wear makeup, get some baby shampoo on a clean finger and just scrub. Make sure you get all that stuff off of your eyelash. I look at your eyelashes at 10x magnification. And I know how much makeup is on those lashes. You got to get that stuff off at the end of the day, okay? Because it can incite inflammation and affect the health of those meibomian glands. You got to do it. All right, so artificial tears, hot compresses, lid scrubs. That's 101. That's I tell people that all the time. Now, there's conflicting data on fish oil. All right, so there are some eye drops that have fish oil in them. I'm not sure if that really makes a difference, but they're probably no better or no worse than oral omega-3s, fish oil, or flaxseed oil if you can't do fish. But there are conflicting reports about that. Some studies suggest it does help. Some studies show it doesn't. I think it's for most people, it's very safe. It is a bit of a blood thinner, so make sure it's okay with your doctor if you take a fish oil, but they're over the counter, so a little supplement's probably okay. And if it helps, if you notice an improvement after a few weeks, great. If you don't, well, then just stop it because, again, I can't really recommend one way or the other because the data really isn't clear. But I do tell my patients, it's okay, give it a shot. By the way, we're past what I'm saying is officially not medical advice anymore. Now I'm just telling you information, okay? And then beyond that, beyond those things, now we're getting into more significant treatments, all right, that are maybe a little bit more expensive. So for aqueous deficiency dry eye, again, we talked about that, right? They got normal meibomian glands, but the patient doesn't make enough tears. Sometimes that's either through Sjogren's or LASIK. That's another one because you cut the nerves with LASIK when you make that LASIK flap, and it can cause a lot of dry eye issues, sometimes very severe. And for patients like that, there are medications like Restasis, which is cyclosporin, that you can use to promote healthy tear production. All right, that has variable insurance coverage and can be kind of expensive for people. And then going back on the evaporative dry eye, sometimes there's temporizing measures we can do. If a patient comes in, they have a lot of inflammation, their eyes are red, angry, irritated. Sometimes we'll give a little steroid on the eye. But you can't do that long term because steroid can induce glaucoma in some people and progress cataracts. So we don't just leave someone on steroid long term. It's always a temporizing measure, a couple weeks, maybe a month. and we see how you do. Kind of calm the eyes down, get that redness, that irritation, that pain to go away, and then we can just focus on more long-term treatments, which are the things we've already talked about. And then there are also some, as far as eye drops go, we talked about the over-the-counter eye drops, but there is actually one thing for very, very, very severe dry eye. Some patients will end up on what we call serum tears. Now, this is really cool, but also insanely expensive, and insurance doesn't cover it. You basically make tears, artificial tears, from your own blood. You send it to a lab, they spin it down, it's got all those wonderful growth factors in it, and you put them on the eye every couple hours, every few hours. They're amazing because it's your own fluid. It's your own. It has like all the immunoglobulins in there and all that good stuff in your serum. Your serum has a lot of just great things in it. I don't know enough about blood to tell you what's in it, but it's good stuff. It's like nerve growth factors. And I'm just going to keep throwing out terms that sound smart. Myosin. I don't know. Anyway, it's got good stuff in it. And it helps. It helps for people with really severe like aqueous deficiency, or like they really don't make tears. I've seen patients with a bad dry eye from LASIK that end up on aqueous tears. But the downside is, again, it is pretty expensive to do that. I'm not sure how much it costs because I haven't seen a patient for that in quite a while. But our cornea specialists do a lot of that. And so that is an option as well. And then there's also procedures. So we talked about these meibomian glands, right? Well, you can do hot compresses to try to open them up. But there's also like in-office procedures. We have like little paddles that you can actually squeeze. This is very satisfying and probably gross to a lot of people. When you look at someone in the slit lamp, you can take a Q-tip, you can push on those meibomian glands and produce that oil. You can see it come out. And if it's like super thick, like toothpaste, those glands are not healthy. They're not producing good oil. But it's really very satisfying. You sit there, you push on those, this oil comes out of these glands. I could probably make a series of extremely viral videos because it's like on the pimple popper like spectrum, like people just love seeing stuff come out of the human body. I don't know why. It's a thing. It's a thing for people, and so I don't like really get that excited about it, but I think other people would. It is very satisfying to see though, because it gives you your diagnosis right there. So why am I talking about pimple pop? Oh yeah. So meibomian glands. So we have paddles that'll open them up. And we also have this machine. There's machines it's like a spa treatment for your eyes. They just heat up and massage your eyelids for you right there in the chair. These are all expensive. Insurance doesn't cover like most of these things. And this is a high research oriented area, you guys. There's a lot of new stuff. People coming out with new gadgets because this is such a big problem for all of society. We're all getting dry. As we get older, we just dry out. And then society, the way society works with our screens and everything, it's just making our dry eye worse. So there's a lot of research going into different ways to treat dry eye. And some things kind of fall flat. Like there used to be this nasal stimulator. This is probably the funniest dry eye treatment that I've ever seen, where it's like a two-pronged nasal stimulator. You stick it up your nose, you zap yourself, you electrocute yourself. It stimulates the nasociliary nerves and produces this reflex tearing. Surprisingly, it didn't go very well. It worked, obviously, but no one's going to want to do that. You know how hard that is to sell to a patient? Hey, you know what? We really think you should be electrocuting yourself. It's really going to help with your dry eye. It just doesn't work, you guys. So anyway, there are some things that have caught on, some things that have not. The problem, as always with things in the U.S., is they end up being crazy expensive when they first come out. So, but it is a chronic problem. Dry eye, it can be a lifelong thing for people. The key is just finding a regimen that works, and And that sometimes can take years to figure out. Sometimes it's quick and easy. Sometimes it's not. And so it's an ongoing area. Tell me about your dry eye problems. Tell me what works for you. I'd be interested to know. Let's see. Have you tried the nasal stimulator? Do you guys like that thing? Here's your don't do that eyeball tip of the week. Don't try to treat your dry eye by like pulling your nose hairs, which is basically what that device was doing. I don't even remember what it's called, but don't do that eyeball tip of the week. The cure for dry eye does not lie in nasal stimulation. I promise you that. Maybe someone out there is going to prove me wrong, but I don't know. Anyway, that's our episode. We went a little bit long, but thank you all for joining me. Thank you to my producers, Aaron Corney, Rob Goldman, Shanti Brook, editor and engineers, Jason Pertiz. Our music is by Omer Benzvi. Let me know what you thought about this episode. I'm a little nervous about this because I don't know how excited people get about dry eye. As an ophthalmologist, it can be a bland topic, but I recognize the importance. And I actually kind of had fun going through that with you guys. So if I had fun, maybe you're going to have fun listening to it. As always, send me your recommendations. I try to keep up with the YouTube comments. I jot down ideas that people send in, that people comment with. So if there's, I still got a good list of things. So yeah, just let me know, and we'll see you next week. Take care, everyone.
Goodbye.
Thanks for watching the episode. You can find more on that playlist over there. If you prefer to listen, or you just had your eyes dilated, you can binge full episodes wherever you get your podcasts. Or join the party over on Patreon, where you get early access episodes, hang out with us, get lots of exclusive bonus content. Hope you subscribe, leave a comment below. Let us know what you think.